You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, dental implants, replacing missing teeth with dental implants. And according to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Landon Libby. Dr. Libby, welcome to the program.
Randy, it's a pleasure to be here, and I just want to thank you. The Wellness Hour is, I'm a big fan, and You're helping thousands of people get the information they need to stay healthy. So thank you for what you do.
Good, good. Well, thanks. I know you brought a lot of photos.
Like I did.
So we'll try to get to as many of those as possible.
Great.
Now, for those people that don't know your practice, like who's the typical implant patient that you see?
So the typical implant patient in my office there's a couple different types. One is the type of person that has been in avoidance, we'll call it. They've been avoiding the state of their teeth for a long time. They are looking, by the time they come into my office, they are taking that big first step, a giant first step of calling and showing up. And so they come in and they are in need of a lot of dental work. So I used sedation dentistry every day. It's like a gift from God for us because it allows us to be able to treat people while they're asleep, which makes it a great experience for them. And it also makes it a great experience for me because if they're more comfortable, I'm more comfortable.
So these people with the bad teeth, I mean, they come to you because they don't want dentures.
People are coming to me because they're avoiding dentures. And underneath that, not only avoiding dentures, but they're looking for a new smile. They're looking for a new lease on life. They're looking for the ability to be themselves again, which, let's face it, they've lost over the years of trying to hide their smile, not eating the foods that they love to eat, not kissing their wife or their husband.
They tell you this?
Oh man, it's amazing how we get to hear so many great stories, and I want to hear those stories. I want to know what the why is underneath my patient's desire of what they want, because that helps me provide exactly what they're looking for. So the second group of people that come into my office are people that are wearing dentures, right? And it's hard to get denture wearers back into the office because once they go into a set of dentures, they tend to disappear. They get out of the cycle. They get out of the rhythm of going to the dentist because they don't have any more teeth, and they feel like they have this final outcome that they're not happy with, but they feel like that's the end. Like there's no more hope for them. Right? So when I get to meet somebody like that, it is so exciting to sit with them and to create, like, give them hope of what's possible, give them a vision of what we can do with new technology and techniques in terms of anchoring that denture to where it's not flopping around anymore. People, I mean... So
is it true? I mean, they could walk in with no teeth on the day of the procedure, if everything works out, and walk out with teeth that don't come out?
Absolutely.
Really?
Absolutely.
Is that rare?
It's, is it rare that there's patients out there? It's not rare that we do that. We do that every day. And it's amazing to see that transformation. And here's the coolest thing about it, Randy, is that a lot of people avoid this process. They hear about implants, they have a denture that's just skating around like a hockey puck. They can't eat the foods that they want to eat. They're embarrassed to smile because whenever they smile, these muscles tighten up and it shoves their teeth down. I mean, it's debilitating. So when we utilize dental implants to help support that denture, to help support their new smile to where it's not moving around anymore, I get people calling me every day, the day after the surgery, going, I've never felt this good. I didn't think that I could live without pain. And now that's pretty cool the day after the surgery, because it is a big fear. I get it. It's thinking about having this procedure done can be scary. And that's why people avoid it so long. They go years and decades.
Because nobody likes going to the dentist.
Nobody likes going to the dentist.
Do you still hear that?
Absolutely. People come in all the time and they say, no offense, doctor, but I don't like you. And I just chuckle and I laugh.
You don't have a one-liner after all these years?
Yeah, I say, I love you too, man. I love you too. And it breaks the ice because the stories of how people grow up, and everybody wants to tell those stories of how it was such a bad experience. And let me tell you, Randy, in this day and age, in San Diego, across the country, there is no reason why somebody should have a bad experience at the dentist. There's no reason. With the stuff that we are able to use and the techniques and the ways we're able to engage people, it should be, and in my office it is, a positive experience every time.
Good. Now, your background training, you've been a dentist probably since 3 or 4 years old.
Yeah, yeah.
I mean, it's kind of true.
I have been.
Dad's a dentist, brother's a dentist.
I grew up I've grown up in dentistry. I like to joke because my dad's side of the family is a lot of dentists. My mom's side of the family is a lot of psychiatrists. So growing up, it was kind of like, do I do psychiatry, follow in these footsteps, or do I go with dentistry? And it's kind of a mixture of both. Being a dentist, I get to really work on people and their fears, and I kind of get to do a little psychiatry and be there supporting people to help move them through a tough time. It's such a rewarding profession, Randy. I can't tell you, it's so exciting to be a dentist because I don't feel like there's any other opportunity to be able to be at the forefront of helping people and change their lives in all aspects, being out of pain, right? Let's go through, let's think of a denture wear here, right? So the life of a denture wear is this. They have that horrible experience as a kid with the dentist putting their knee on their chest and taking teeth out with no anesthetic, right? They get through and they get in their teenage years and they're getting cavities and they get new cavities underneath fillings and they're bigger cavities, they're paying their root canals, and so all of a sudden they're paying thousands of dollars every year where it feels like to them they're having the same teeth treated over and over again.
Yeah.
By the time they get to that point, and some people, you'd be amazed, some people are wearing dentures by the time they're 20. There's a lot more people,
even
young people like that, even in San Diego. So when they get to the point where they're like, and you know when you get to a point where it smacks you in the face like, I've made my decision. That's how people get to when they're losing their teeth, is they've gone through this painful episode and expensive of losing one tooth and treating this tooth, and I can't chew on this side, so I'm chewing on this side. And once it's smacked, they come into my office and they go, I'm done. It's like throwing in the white flag. I'm done with these. And I consider that kind of an epiphany, and I enjoy supporting them through that because they are right. It is time to be done.
So everybody could get a brand new set of teeth.
Everybody can get a brand new set of teeth. When you get to that point, implants are your new best friend. Implants are something that are going to give you that new lease on life back. They're going to give you your ability to smile and not hold back.
Okay, you brought photos. What are we looking at?
I brought a lot. I don't know if we'll have time to go through all these. So this is a great story, Randy. This is actually my aunt. Okay. She's a distant great aunt. I grew up with her, and her name's Tukey. She loved to smile. I remember her as a little kid with this big smile and a vibrant personality. I went to a family reunion. This was about 2 years ago, and I saw her there, and she looked like this. And her teeth were all broken. They were all black.
Like that. That's got to be unusual, right?
This is actually not unusual, Randy. You'd be amazed at how many people in San Diego, across the country, are in this condition. Now, you may not know it, right? Because what are they doing? What are they not doing when they're like that?
Not smiling?
They're not smiling.
Okay.
They're not smiling. And when somebody's not smiling, what is the first thing we might think of? We might look at them and go, they must just be a pissed off person, right? They must just be angry maybe they're angry at me. I'm gonna avoid them. Okay, so when people around us, Tukey for instance, start avoiding you because they think you're mad, what does that send you into? All of a sudden you start isolating yourself. You start getting out of the community that you're a part of because of this debilitating condition that you have with your teeth. So they tend to kind of
don't hang out with people. They don't go out to eat with people, things like that.
How can you? How can you go out to eat when you can't?
Now she's your aunt. So what do you say to her?
Yeah. So I went up. I walked up to her and I said, Tukey, what happened? And she just gave me the story that this is based on medications that she started taking, and that's a big thing. People are taking a lot of medications. Drying out her mouth or something? Drying out her mouth. Digestive issues that she's having because she can't eat. She's having massive system digestive issues, right? And so she just said, I have no hope. I don't know what to do. And my family's full of dentists, you know, this is a Libby family reunion.
But you're the first one to
actually. And I walked in and I said, if you get yourself to San Diego, I'll help you take care of your teeth. And lo and behold, the next week, she's She calls me, she's got a ticket, she's coming down and staying with me. Her options are, in this state, an upper denture.
Okay.
Right? Take all her teeth out and give her a plate that covers her whole mouth and you don't taste anymore. Or using implants to help with a new smile that's actually fixed in there, or snap in, snap out. She had a consultation back at home and they told her, here's your only options. You're going into denture.
Really? Okay.
So her hearing from me when I told her about implants and what they could do to help her, I could just see the life kind of oozing back into her. I could see her kind of getting that juice back. So in one afternoon, we're able to numb her up, take all these bad teeth out, place 4 implants in there, and give her a brand new smile all in one day. This after photo here that you can see was taken 3 days later. And I keep trying to get a hold of her and have her come back, and I'm like concerned because the dentist side of me is going like, how is the bite feeling? How is it functioning? What is going on? And she just keeps replying back, I love it. I love it. It's perfect.
So she can eat whatever she wants?
She can eat whatever she wants.
Do they have to be careful, like with a carrot with her front teeth? Or an apple with her front teeth?
So no. If you have your teeth fixed on implants in there, you can eat whatever you want.
Eat whatever you want.
Now the thing about eating, and this is a great example, is that when you have bad teeth or you're wearing a denture, you got to stay away from certain foods, right? You just can't. They have to be selective with what they're eating. So they can't choose what they want on a menu when they go out to eat. They're eating soup and mashed potatoes, sides, because they can't order the steak.
Okay.
So it has a drastic effect on your ability to eat and your digestive system. So giving a new smile where they can actually eat raw broccoli, they can eat carrots, they can bite into that steak and actually sense the aroma and taste it fully and all the juices flowing around their mouth. I mean, those are little things that you and I might take for granted because when you have your teeth and you're not in pain, it's not an issue, but for these people, it's something that they're missing.
Yeah, but what if you've been wearing dentures for like 20 years or 10 years? Isn't it true you don't have enough bone to do this?
So that's a great question. And we hear that all the time. Patients come in and say, I was told that I don't have enough bone. And it is true that when you're wearing a denture, your bone disappears because your bone has one goal, has one purpose, and that's to support your teeth.
Okay.
So if that purpose disappears, if your teeth are gone, your bone just kind of starts to shrivel up and disappear. The answer to your question or their question of, do you have enough bone? My answer is always absolutely. With the implants we have now, they go from tiny to bigger. We can custom pick the implant to fit your situation.
Now the challenge, and we were talking before we started taping here, but the challenge is getting people to get off the couch and go visit you, right?
Right.
Now you do a thing that I've never heard of before.
Yeah.
We've never had anybody on the show talk about this.
Yeah.
You do virtual consults.
Absolutely.
So I guess they send you a photo of themselves. You tell me what they do. So if somebody's watching this right now.
Right.
Not in the mood to go to San Diego to see you.
Right. So I'm going to tell you about this, and I'm going to use Paris as an example. Here's another one of my fantastic patients. So a virtual consultation, I realize that people don't want to drive across town or to my office in Mission Valley. They don't want to come in, and it just seems like a lot of they're avoiding, right?
Yeah.
So they don't take that step. A virtual consultation is my way of breaking down those barriers. A virtual consult is where Paris would send me this picture, the before picture, and then he would tell me what it is that he's looking for. What would he change?
So you actually put on there, like, tell me what you want.
Yeah, so
like
you
would
go on my website, you would click on my virtual consultation right at the top of the homepage. It's going to ask you to take a selfie and then put a description on what you would change. It may be, I want to be able to eat again. I want to be able to smile. I mean, all people are looking to smile and eat again confidently.
Okay.
So what this consultation is it allows me to take that and I film a personal video. It's about 10 to 15 minutes long, and it says the whole goal is for me to introduce myself to him, and then for me to go into, I hear what you're saying, man. There's a lot of people that are struggling with things just like you. And I tell them, there's always 3 questions of what people are asking. One is can you help me? Okay. I want to know if you can help them. Are you qualified? Do you have the personality and the connection to be able to hear what they need, hear what they want?
All right.
The second question is what's the steps that it takes? And the third question is, how much does it cost? That's a big barrier.
So you go over that on the video?
I answer those 3 questions in depth.
Are you going to be overwhelmed with people? Because
I hope so.
We've been airing for 20 years in San Diego. I mean, this is, you said it's like an hour, 2 hours a day to do this?
Yeah, I do virtual consultations every day, and as they come in, then I'm able to send these videos out.
So you're not worried about it, like getting too many of those people wanting consults?
If I could get in front of people and help people ease the unknowingness. People are scared of what they don't know. People avoid the dentist because they're in such fear that it is like they are beyond help. Literally, people think they're beyond help. And so by conversing with somebody on a virtual consult, giving them and then meeting them face to face, I see their eyes light up. I see their face start to light up because they know. So you did this for this guy? Yeah, so we got this, and he was all in from the very beginning.
So what were his options?
So his options are like anybody in his situation. You can see in the before picture, his teeth have taken a beating, and he's at that point where he's throwing in the white flag. So you can either give him a denture, or we can use implants to help support a new smile that he doesn't have to take in and out. Now I want to point out that implant dentistry and what we do as a dentist is all about customizing it to you as the patient.
Okay.
There's a lot of centers across the country and in San Diego too that you go in and they advertise teeth in a day, and that's one option. Take all your teeth out, get implants, a new smile in one day, which is a fantastic treatment, and that's the best that we can do to help people get their teeth back. Yeah. But you got to realize that not everybody's in that financial position to be able to maybe afford that, right? So it's kind of like there are options. There's a snap in and snap out. We can do as minimal as 2 implants on the bottom, which is life-changing to be able to kind of anchor that bottom denture, and it's way more affordable than the creme de la creme.
So what did you do for this guy?
So for Paris, we did a snap in, snap out. So in one afternoon, he comes in, we take all his teeth out, and we give him a new set of teeth. Now, if you saw that big smiley face walking down the street, I guarantee you wouldn't say that that's a denture.
Yeah, no.
Or that those are artificial
I told you
teeth.
Off camera, I said, I could spot a denture walking down the street.
Right, I know you can.
Well, it's because you're a cosmetic, you have formal cosmetic dentistry training. Is that right?
Absolutely, yep.
So it kind of helps you with what you're doing. Is that right? You're looking for it to look good and to work well?
Right. It has to look beautiful. Everything I do has to look beautiful and it has to function well.
Okay,
so let's look at some other pictures here. So Randy, you got to see this next patient. You're going to love this one. So this is Tahani. She came to me because she had no back teeth. She has some front teeth there, but no back teeth to chew. In fact, because she had no back teeth, her gums were actually chewing on themselves. Does that make sense? Like her face had collapsed enough to where it was just, there was no room back there. She was gumming all of her food. So by designing her new smile, not only are the teeth beautiful, not only do they follow the curvature of the lower lip, but you can see how these wrinkles on the side become less and less. Her face looks younger, it's more youthful because it's restored back to how it should be. And that is a beautiful thing to be able to take somebody.
She looks more attractive too, no doubt about it.
Absolutely.
More sophisticated.
Right. There's a lot of things with teeth. Now, teeth are important. A smile is important.
That does not surprise me.
I'm going to tell you that right now. A smile is important. It's so important in so many psychological aspects. When you look at somebody in our society and say they're missing a front tooth, you immediately judge them to be what?
Maybe poor
or uneducated or that they don't care, right? That they don't care about themselves. And that right there is where a smile can come in and absolutely change somebody's life, because it can change the perception of how other people see them.
Interesting.
And more importantly, man, a smile is a reflection of the confidence that's inside you. So when I see her with that big new smile, I'm seeing that inner confidence, that inner joy, that inner youth, that inner passion and desire to live life to its fullest. It's coming out through her smile. And it was all because we were able to give that confidence and she's able to let it rip.
When it's all done on the follow, I think you told me this on the phone. When they come in, it's like almost a different person.
Right.
Like they walk differently, they act differently.
Right.
Sometimes dress differently.
Right.
Really?
Yep. They come in and it's let me show you this one here. This is a great one. When you going back to what you said about they act differently. When people get their new smile, they come in and they're very reserved. So Kathy is somebody that came to me and she was completely. I would have thought that she was depressed.
Okay.
Right? How she came across was just down and out about who she was. And she had loose teeth, missing teeth in the back. Teeth were loose because of gum disease that had been happening forever and ever. And to take her through this process in one day, we're able to take all her teeth out. Is she another person that would have got dentures? Absolutely. And she was told this, right? She had an event in about a month up in Vegas. And she said, I'm going to this event, and if I could have a new smile by then, it would floor me. So walking through this, we sped things up. We got her a new set of teeth on the top that was fixed on dental implants, a new smile. And she all of a sudden is coming into the office. She's bounding in, she's hugging everybody. What I love most is when patients won't leave my office. I'm done seeing them in the back. I'm done with their teeth, the technical part back here. And all of a sudden, an hour later, I see them having coffee and they won't leave my front desk alone because they just want to sit there and chat it up. So that right there is just it's an enter back into society. They're entered back into life. They got a new lease on who they are and their community and their kids, their grandkids. A big thing with untreated gum disease, this is huge with denture wears. Most people lost their teeth because they had gum disease that wasn't treated. Gum disease in my office.
But if your gums are bad, like gum disease, are the gums good enough? You can't get dental implants?
No, that's not true, because gum disease is all about the teeth. The teeth in the gums are holding on to all this bacteria, which is causing the gum disease. So it doesn't mean we take it into consideration about this bacteria, but there's very little correlation between gum disease with the teeth in there and gum disease with implants in there.
Okay.
Does that make sense?
So when you remove the teeth, the gums get healthy?
Right.
Okay.
Right.
Time for a couple more.
Okay.
And we literally are short on time. I'm not trying to rush you here.
No, you're rushing me here, Randy. So this is another fantastic, wonderful lady, and she was a case of somebody who's been to the dentist her whole life. She's had treatment on every tooth. And she's frustrated. She walks in angry at me. And I hadn't even met her, right? But she's angry at the fact that she's back in again because this tooth has now fallen out and she doesn't know what to do. So walking her through this a new smile using dental implants. So when you go deeper,
all these teeth couldn't be saved. They're all bad.
Right.
Okay. So you remove the teeth.
Right. Remove the teeth.
Give her new teeth.
Place the dental implants, and this is all done under sedation, so she is just snoozing away. Okay. And we place the dental implants and attach her new set of teeth. And she wakes up, and I wish I could be there.
That's a pretty smile, by the way.
Yeah, thank you. Right after this, it's amazing. She wanted to do she wanted to do just a glamour photo shoot. She was throwing her head back, and I wish we had a fan to get her hair blowing. But again, confidence in your smile, joy starts oozing out of you.
So we have time for one more photo.
All right, just two more, Randy.
Two more. Well,
two more?
Quick.
Okay, I got my stack here. So this is a gentleman who came in, and you can see that big space in front of his teeth. He had a hard time letting go of that. Even though he did not like it, his mom had that.
Okay.
So it is very interesting. Every patient I see, I sit knee to knee with them, and we come up with a customized treatment plan of, not a treatment plan, a customized option that's going to give them the smile that they want. He had a hard time with us closing that space. Now his new teeth, he doesn't have that gap.
So this guy also would have been wearing a denture.
He would have been wearing a denture. He had no bone on his back teeth. So
that looks good. Guy's looking good.
He's walking around driving his truck around the country, just loving life. Okay, another one. This is one of my good friends. This guy was actually one of the winners of one of the first episodes of Hell's Kitchen. He is a phenomenal chef.
Wow.
He is unbelievable. And with his current situation, he couldn't chew his food. He couldn't eat his own food. He couldn't taste it correctly. He was like, and life hit him hard. So Mike came in, and his options are denture, which then he really can't eat the food and taste the food that he's making, or implants. And as you can see on this after picture, he's a whole different man. You can see that his eyes are smiling with his teeth, right?
He's looking good.
You can see the life back in him. He's on his way to open up his own food truck. He wants to have this custom food truck, and he's looking to go back on the show for a reunion show. So it makes me tingle inside to know that this guy's life has been benefited.
We literally have about a minute left, but how old can you be? I mean, like some of your patients in their
that's
80s?
A great question. A lot of people avoid dental implants because they think they're too old. And I want to tell you that that's as far from the truth as possible. I had my oldest patient was 89.
Wow.
When we put dental implants. Her reason for doing it was that in the last chapter of her life, she wants to enjoy her food, right? So every person, no matter how old you are, can benefit from dental implants.
Now, implants are not covered by like Medicare, Medicaid. Even the best dental insurance covers a small portion.
Right.
You have financing.
Right, absolutely.
Are people financing this?
Most people are.
Okay.
This is something that is easy. I liken it to like if you're going to buy a car, right? It's pretty easy to go buy a car and finance your car. The cool thing is that within the medical community, we're having those options now. So the financing has never been easier to help pay for you to get your new smile and get your confidence back.
Okay, good. And we're out of time. Okay, but people need to know. I mean, this is something we've never heard on the program. You're willing to offer this free virtual consult where they send you their photo, what their goals are,
right?
And then you make a custom video for them that's like 10, 15 minutes long,
right?
Telling them the options, even going over fees on the phone, things like that, on this video.
Right.
And I even warned you. I said, are you sure you want to bring this up on the show?
Yeah,
you might be inundated.
Absolutely. It breaks down barriers. It helps people take that first step. Obviously, the next step after that, after the virtual consultation, is you come in, complimentary consultation with me. We take a 3D x-ray with the technology in my office. Then we can pinpoint the plan of exactly what's gonna be the right fit for you.
Okay, good. I want to thank you for coming on the show. Final message, somebody watching this, but for whatever reason, they're still afraid.
If you're still afraid, final message, if you're still afraid, the biggest thing you can do is take that first step. I'll hold your hand the rest of the way. Take that first step of reaching out to me at sandiegodentist.net, on Instagram, Dr. Landon Libby. You can find information there, but reach out to me and I'll take you from there.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thanks, Randy.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.